Hey everybody, today I thought I would talk about mental health employees. And the reason is I've had some experiences that I wanted to share, and I also wanted to see what other people have experienced. And I want to know what people are thinking of some of the things I've been thinking about, people who work within these programs and systems. So anyway, I wanted to talk about something that happened to me this week. Uh, I, I, a couple of vlogs ago, I said that I was no longer going to see my therapist, but I decided to keep trying because, for one thing, I needed her to help me get a letter stating that I need my dog. That he's basically like a companion or like an emotional support dog, and so I went and saw her this week so that she could, write a letter and state that. And anyway, so that's why I saw her again. And plus, I figured, okay, maybe just give her another chance. This is like I think the third time I've seen her, and she she keeps doing this thing where she's basically not there at all. I am trying to express my problems and she is doing something else. She's not listening to me. She is off. And she's a therapist and I think that's supposed to be her job. I thought that's what therapists do. I thought sorry, my dog. I thought they were supposed to listen to you. And anyway, she's been doing this to me every time I go in. She's trying to find ways to, not fully be in in the meeting, and she tries to shorten our appointments as well. And so I've just been really disappointed with her, and it's making me question why this woman even works with people who have mental health issues. Why is she a therapist? Hey, no, there's a kitten outside. My dog's a little jealous and concerned, but I just don't understand why this woman is working her job. Like, why is she a therapist? She's not listening to me. She's just not a good therapist at all. And the only thing I can come up with is that she is in it for the money. So yeah, I'm just greatly disappointed in this woman. I do not feel heard at all, and it's kind of bothering me. I will probably ask for another therapist soon. I'm hoping that doesn't affect the letter I got from her. Anyway. So that's something I've experienced a couple times with therapists that I've seen over the last few years, is they're just not listening to me, and I don't get that. Anyway, another thing I've experienced is where I've gone to I've gone to an appointment, and as I'm waiting out in the waiting area, there are receptionists at the front counter who are either, they're talking about the clients and they're not saying nice things. And this happened to me pretty much every clinic I've ever gone to. They just sit there and they make fun of some of the clients, or I've also seen them, kind of react like, oh, how crazy of them to do that. Yeah, they're crazy, dude. They have a mental health problem, and you're sitting here, Rufus? No, Broom. But these people have mental health issues, and of course, they're going to do things that are crazy, and it's not your place. Especially, it's totally unprofessional for these people to talk about how crazy these people are when they're trying to seek help. I don't understand how these receptionists, these employees, think it's okay to do that. And I've also had it to where there's people coming into these places who are suicidal, and there's some people who are just messing around on Facebook, calling their friends, talking to their family. Oh, hold on, Mom, I got a client here. You know, they're all annoyed that they have to, you know, help these people. Or they're busy, like, you know, making jokes and small talk when this person is breaking down, you know, possibly breaking down. And I don't understand how these people are not. I'm assuming they are trained. Maybe they're not. If they're not, then they need to be trained. And if they are, they need to have more training. It's just totally, it's messed up. And I'm sick of seeing it in these places, you know? It's disturbing. And yeah, anyway, so there's that. And then, you know, like I said, the problem with my therapist. And another thing that I've noticed is, um, okay, you're going to these places to get help. You have a mental health problem. Sometimes you're not always going to make it to your appointments. This is part of your mental, a lot of people's mental health problems. They have problems keeping things in place, going to appointments, because they're probably having emotional mental breakdowns. And people are, they get you know, upset when you miss an appointment, and they don't take into consideration that you have a mental health problem. And it's like, what, how, okay, how, you know, how could they not do that? How could you not see that you know, this is probably their health problem affecting some of the things that they aren't, you know, that they aren't doing, you know? Oh, you're not taking your medication. Maybe that's your mental health, you know, you're forgetting, I know that happens regularly with a lot of people who have bipolar, and I know that, and, you know, are missing appointments, or anxiety. There's all kinds of reasons why people may be acting the way they're acting. And another thing is, you know, some people who don't want to talk or get irritable or aggressive, maybe they have oppositional defiant disorder. Maybe you're triggering them, you know, and they feel like you're trying to control their life and their situation when they go in there. I mean, why wouldn't they, when people are telling them to, you know, you have to take these medications, you have to be here, blah, 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 you know, fill out this paperwork. And that's another thing. I mean, I've noticed that some of these places and some of these programs are asking people who are mentally ill to remember to regularly fill out paperwork for some of the other programs that they're in. And it's like, dude, these people are mentally ill, and you know, I mean, it's like, I get that these people have things they have to do and follow, but I mean, if somebody can't do something, then you need to offer to help them do it. And, you know, I've noticed that some of these programs haven't been doing that. They just assume this person's an asshole or, you know, irresponsible. And it's like, no, they're having health problems, dude. Like, how are you not seeing this? You work at a mental health facility, you know? And so I just keep seeing stuff like this, and I wanted to share that, and, you know, how stuff like this needs to change, you know? I mean, I don't understand why these people are not seeing some of the things that I can see, you know? It's just not making sense to me. And, you know, I figured I'd share it. And I hope, you know, I just hope that someday that these programs are, you know, I mean, and the employees are a little bit more educated on what, you know, what may be going on with some of their clients and the people that they are working with daily. Because, you know, if you're working in a program like, you know, for mentally ill people, you just need to, I mean, you need to be doing it to help them. You don't need to, if you're in it for the money, you really shouldn't be there. And that's another thing. Like, I also question the people, the therapists, what are they doing to cope with some of the shit they hear every day? I mean, there's patient confidentiality. How do these people express how they're feeling about what they're hearing, you know? Are you still in the video? And, you know, how do they, you know, how do they deal with it? And if they're not dealing with it, if it's not affecting them, then there's something wrong with them. If you're not being affected by that, you're you're probably a sociopath, in my opinion. I mean, how else could you? I mean, I'm sure these people are taught to detach in some way, but it still has to affect them. And I just wonder how they deal with that. And, you know, yeah, that's been something that's kind of been bothering me too. But anyway, so I guess this video is like for, you know, people who work at these places to like please take into consideration some of the stuff that's either coming